Good evening, good afternoon, and good morning. This is the 1467th day of continuous webinar conducted by International Forum for Promoting Homeopathy. We welcome all to this session, and today our guest is Dr. SHEETAL Bidri from Bangalore. Let us begin the session with 1 minute silent prayer. Thank you all. As you all know, the International Forum for Promoting Homeopathy comprises of well-wishers of homeopathy, homeopathic students and doctors, and we have 3 sessions every day, 7:30 to 8:30, our Hindi session, which is just over, and 8:30 to 9:30, we have our international session in English, and 9:30 to 10:30, local language session in Malayalam. We are uploading almost every videos every day, on the very next day itself, so that those who miss the first part of the session can join and watch again and again. You can also subscribe the same. Those who have not yet seen the same can subscribe by searching IFPH homeopathy. And let us come to today's schedule. We have a guest in Dr. SHEETAL Bidri she has completed MD in Pediatrics and is the founder of and physician at Happy Healing Holistic Homeopathy Clinic, Bangalore. And she is a very passionate homeopath and a holistic health practitioner. Has completed her MD in pediatrics in 2018 from Government Homeopathic Medical College Hospital, Bangalore. She is a person who has trained under various eminent doctors from Bangalore, Pune, Mumbai, and Kolkata. She has been instrumental in editing some homeopathy books written by eminent authors in the field of homeopathy. That's a great thing. And she has worked with the eminent Dr. Sunitmal Sarkar, who handles various forms of cancer through homeopathy and holistic practice. And anyway, that's another big point for you can note about her. She is always interested in studying more and more about homeopathy. That's why she is searching almost taking classes from various eminent doctors in the field of homeopathy. Currently, she practices in Bangalore at Happy Healing Holistic Homeopathy Clinic. And she has a very good experience in that field also. Has successfully completed 2 seasons of conducting a consistently module for homeopathic students called 7 Days, 7 Remedies, where she encourages homeopaths to adopt daily reading habit to improve knowledge and practice. That is also a requisite for becoming a very good doctor. She indulges in a good fitness, a routine of walking, running, or yoga, and inspires many others to do the same thing by showing that she is an example for them to watch. She focuses on treating patients in holistic approach, keeping the mind, body, and soul in sync with homeopathy, a good diet, and a healthy lifestyle. You can know better about her by going through the Instagram pages, YouTube, LinkedIn, Twitter, Facebook, and all those things. Everything was written in the poster itself. As you know, we all know that she has presented a beautiful session last time on acute prescriptions in pediatric cases. And today we'll be talking about the second part of the same. As you all know that if you want to establish yourself as a very good homeopath, definitely you will have to treat and getting results from treating acute cases, particularly pediatric cases. If you are successful in those cases, definitely more and more people, patients will come to you. Anyway, let us welcome Dr. SHEETAL Bidri to this session. Welcome, Doctor.
Thank you so much, Dr. Dhanesh. It's a pleasure to be back here and to connect with all the homeopaths across the world, in fact. Today, we will be continuing what we had left off in the part one, that is acute prescriptions. And I know that I am talking to a lot of practitioners here, some students as well. And largely people, I can see that they are trying to log in from where clinic and home and everywhere. They are showing their commitment as well. So I love that part. As a homeopath, I know that we are keen to learn, and I love to keep updating myself and reading as well. So today, I will be, with respect to the previous session, we shall taken a few more understanding of how a pediatric practice can be very easily accessible, because I feel that pediatric practice could be a little bit more easier, because you know that the children per se are very innocent and have a very straightforward outlook to the life as well. So without much ado, you can be active on the chat window, which would be, the interaction is always nice. And just let me know when you are you able to see my screen.
Yes, 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 yes. Visible, visible.
Super. All right. Just a second. I don't need. All right. So keep your chat box open and then let me know that what was the main thing that we discussed the last time was what exactly should we look for, especially in the time of acute, because when acute case is presented to you, it is short. The onset is short. It might be from few hours to a few days. When it comes from few hours, the observations are very, very right there in front of you. And if you're able to see the patient in person, then nothing like it. So what we discussed the last time was the main pillars in in a pediatric case taking. In the form of acute per se, we can do the chronic sometime later. But what do we look for in an acute case? Main thing is the observations. Of course, we are taking the presenting complaint, the onset, the duration, the concomitant, and the modalities. We are doing all of that. But what we should not miss is something that I am going to highlight on. So that is the observations. We discussed that in detail the last session. So go back to the previous recording if you have missed it. The part one. Of course, we spoke about immunization, that can be the causative factor as well, and the ailments from that is basically the causative factor, which is so prominent in pediatric patients, because it just happens that they do not take much time to react, right? They are very receptive to the surroundings around them, changes in the diet, changes in the environment that the family might be going through, changes in school. If there's a slight bully situation in the school, also can result in various problems. Like the just two few days back, I met with a patient who was bullied in the school so much that she would not want to go to school, and there were temper tantrums, and then there was a period where she would feel very upset because of that, and the parents had to seek help otherwise. So what exactly happens, that only a homeopathic case taking or a thorough case taking can hint, no doubt. But as a practitioner, you should always ask. Even if you do not get a proper answer the first time, the second consult, probe it. What was new? What was new? What was new? That is something that will help us to understand. An observation in terms of examination and what we are seeing and how the parents are around, all that we discussed in the last time. So I want to ask you, what are the common complaints you see in your practice, especially when it comes to children? What are the most common things that you might see? I'm opening the chat box so you can just please type in what are the most common things that you see in a pediatric practice. how do children come to you, or how do parents come with what kind of complaints? So one of the most common is like how Dr. Abhilasha, Dr. Shivani is telling, the recurrent cold and cough, right? Very, very common in children, definitely. Then what else? Fevers, yes. Dr. Lata is saying fever. Dr. Shivani is saying upset stomach, unexplained stomach pains, very good. Low appetite, fevers, worm infestation, recurrent tonsillitis. So now all of these, we generally have one set idea of everything, right? We might want to go inside and give our favorite remedy. So let's see if we can try not to do that, and see what exactly we can do to be more specific and exact with our remedy prescription. So the most common thing that we can see is cold, cough, sore throat, ear pain, very commonly. Of course, in terms of ear pain, please do an examination so that you know that there is no foreign body inside the ear, because very common in children which is below 1 year old, it's possible to have things stuck inside the nose and the ears, or even swallowed as well. So fussy eaters, something parents come to us and they tell that my child is not eating, not so understand what exactly is the complaint, and how much exactly the child is eating. Is it really a fussy eater? The parent is expecting more out of the child to eat more. Urinary tract infections, more so in small girls, I'm seeing in UTI, skin infections, eczema, atopic dermatitis, all of that is common. Bronchitis and bronchiolitis, that is also very common as a diagnosis, which presents with them as um, cough and wheeze, and with various bronchi and captations in the on examination. So, like Dr. Abhilasha is saying, nowadays asthma is very common in children, which is very, very true. If you see in your, when you study atopy as a topic in, Nelson's pediatric a book, or Opighai or anything, we'll see that there is a whole chapter for childhood asthma. So if you understand the pathology of atopy, you will understand why children are ending up in asthma so often, various skin complaints why so often as well. Now, that is something which we know as a diagnostic point of view. We are able to see them in the clinic, but as a homeopath, we do we do see certain extra things, right? We do see that the parents are not just asking us deeper questions, but also we know that we have to look into our patients if they are sensitive to certain things, if there is a lot of improper eating habits, no mood. Very commonly parents want to ask, like, the child doesn't have mood to do probably study or play or extracurricular activities, constant whining, complaining. If the child has been angry, aggressive sorts, is there any change in that particular behavior? If there are temper tantrums, lying, lack of social interaction, you can all this is observed in the clinic as well. And also on understanding, there can be cases of sibling rivalry as well. So as a homeopath, we see not just the acutes in the form of cold, cough, fever, constipation, abdomen pain, lack of appetite, but also we see deeper situations which might also be leading to these recurrent acutes. Like, for example, if the child has been going through trauma in the school recurrently, the child is going to be probably facing the stomach pain regularly, or the unexplained stomach pain, what they usually say, but or they might be malingering, or they're feeling sick, right? So they might be just lying to their parents that they don't want to go to school. So as homeopaths, we do have a little extra work to do to understand the child a little bit more, right? Now, today we can do a lot more with cases, but I'm going to take up a few cases that could make us think a little bit more. So I want you to read the case or understand what is presented to you on the screen, and then interact and tell me what are the remedies that you're thinking about, right? So if you, the whole point being that, I want you to give your mind a little bit of work, right? So we have how many have joined in? We have around 40 people here, and I at least want five to be awake and answer and give me some remedies for the case examples. So the first case, now case of a 1 month old child. So it's a 1 month old child, not been able to pass stools from 3 days, and there is a lot of vomiting of curdled milk after feeding. The mother is telling that the child is not able to sleep. Mother says, probably if he sleeps, he might do better, he might feel better. The child is on, even when the child is trying to pass gas, or whenever there is farts, the child is screaming and squirming and then starts crying as well. So the mother thinks that there is a discomfort in the abdomen, but of course there is discomfort in abdomen, because when the child is having stress while passing gas, of course the child is having something related to abdomen. And of course the curdled milk, even after being burped regularly, even after taken precautions, the child doesn't vomit out whatever has been fed to the child, there is vomiting of curdled milk after every feed, and now the child is also not able to sleep. So what are the remedies? This is the gist of this the case I can give. And how much can you ask in a 1 month old child, right? What other things can we ask? We cannot ask thermals right now, because the thermals will be varied. Thermals can get changed, and the child is just 1 month, hasn't yet developed a complete personality, so we are not going to ask a lot of nature and everything. So this is what I meant when I said that pediatric practice can be quite simple, because it is what it is. Like, you cannot fake it, you cannot get something out of the blue. So now, yes, we can ask about urine. Urine is normal. Activity can be on the child as a 1 month old needs to sleep at least of 18 hours of sleep, and the child has is got more wakeful time than the sleeping time. So yes, there is sleep, the kind of feeds, what happens during breastfeed. Birth history is uneventful. Breastfed, this is breastfed child, not a bottle fed child. Okay. And this is the information you have. What are the remedies that you can think of? Now, I got that some of us have already responded. I love that Dr. Abhilasha, Dr. Shivani have told Etuza and Nakswamika. Dr. Sharda says Etuza. Raheen says Etuza. Nakswamika. Nakswamika. So the consensus is Etuza or Nakswamika, right? So how do we know what is the right remedy here? First thing, if we give the remedy and it doesn't work, of course it is, we'll get a clarification of what if the remedy was right or not. But when the child is not passed through for 3 days, the mother is going to panic, and you need to help the mother to feel better more than the child, because the child is not in the distress, but the mother is very, very anxious. So handling the mother will become the second most, I mean, the top most important thing here. So there is no gastric infection issues from the mother, because if you see the first month, the first 3 months at least, the mothers are very, very careful and they eat very minimal as possible. Now, some of us might think that we can give the remedy to the mother, which also works. But when the mother is not having any complaints, I would prefer giving the remedy to the child itself. So coming to the remedies, I too thought Etuza, but Etuza needs to have a little bit of violence, right? So the violent behavior in any form or any way if you have to prescribe Atuza, the vomiting can be a little bit more violent, right? So for me, Atuza did not fit as much as the remedy what I gave, because um, let me tell you what I gave. I took the Fatak repertory, and I took it as vomiting curds, sleep, half asleep when aggravation. So the child is not getting a complete sleep, right? And the first remedies those come for curdled vomiting is Ituza, Calcarea, Catrum phos, Sanicula, Silica. These are the remedies, but for me, Valeriana was the far more accurate remedy for this child, so that the child feels better, not just in terms of the reduction in the vomiting, but also needs to pass the stool, but also needs to sleep as well, right? So the main concern was the vomiting here. And the constipation. Now, of course, the gut is a little discomfort. So we prescribe valeriana in 30 potency I told them to take every 4 hourly, but within the second dose the child had passed the stool, and within the first dose the child slept firstly. Second dose, the child passed the stool after that, and the child did not require actually the third dose at all. Within 2 doses, the child did not have that kind of discomfort, the difficulty in passing the gas. All these things got better within the first 8 to 12 hours of administrating the medication. So there I just stop. If you really want to give something more, you could um, support it with a biochemic. But I thought this child is just 1 month. I don't want to medicate much, so I just give one globule of the 40 size, which has been taken, crushed, and mixed with mother's milk and given. You can also give it in mixed with water and give 1 drop of it. But this was the way I prescribed and administered, and the child got a lot of relief as well. So now Dr. Raheen has asked me to explain the second rubric I took. So I took the rubric that, when the sleep is not complete, or the sleep is not, now, for example, like the mother said, if now for me, the criteria for a 1 month old child, firstly, is that I ask how many hours are they sleeping in a day. So in that, if the child has not slept for more than 10 hours or 12 hours, it is not good. Now they get cranky, they get irritable, they do not function without sleeping. So for for this child, sleep when not completed, I wanted the child to sleep as well. And I found this rubric very, very apt for him, that, when the sleep has not been completed, even the mother said, when the sleep was not exactly completed, or the mother's instinct says, right, that, but if the child sleeps, he might feel better, but the child is not sleeping. And one of the I have seen that, most children, if they fall asleep, their gut, if they have constipation, they just pass stools, they don't need anything else. If they just sleep sound, the next day they are passing the stools really well. So that is what I did. And if I went to, now I did the analysis in Fatak's repertory. Okay, which is handy, very, concise, and to the experiences what Dr. Fatak has used, and I know that it will work, because it is his experience that is converted into this wonderful repertory. If you haven't used this repertory, please try to utilize this alphabetical repertory, so that you could use them in various cases. Now, if I go to the Boric Materia Medica, because I love Boric Materia Medica, so I just, because when you read it, you need to have it in your mind. So this particular sentence, which is there in italics, I took, I remember it as well, that child vomits curdled milk in large lumps after nursing, which is another thing, and bloated hysterical cramps. If you see in the generalities part of Boric, also in that Boric says hysterical flatulency also. So there is a lot of gas formation as well. So here there might be diarrhea. There is a difference here that the child can have violent screaming in children, spasms in the bowels after food and at night. But even though I did not consider the rubric of constipation, it really helped the child to pass the stool. So here, child vomits curdled milk. Yes, we have it in Etuza, no doubt, but do not. If anything, if you, I want you to, if you don't have it in the clinic, please order it immediately, because most cases where Etuza is not helping you, and if that violency of Etuza of is not there, think of valeriana as one of the remedies, and it's good for most pediatric cases as well. So you could read up more about valeriana in the coming time. So, and we'll take up another case if and we'll do the questions in the end of the session if there are any questions. So this is so I wanted to interact in terms of the remedy right now again. Now, this is a case of actually a cerebral palsy patient. It's a cerebral palsy patient where there is hypoxia at birth, basically. The child did not cry when the child was born, so he landed up in a lot of delayed milestones and in terms of the gross motor, but the dentition had also started by the 7th month, which was on time. Now, this child also had convulsions that is brought upon whenever there is an extreme excitement. When he's excited, when he's laughing a lot, he's playing a lot, and then he would, you know, get convulsions. So one of the things with my patients who have, chronic diseases like um, cerebral palsy, MR, cerebral palsy, autism, or gross developmental delay. So these parents are with me for for a longer time, right? So one of the most important role as a homeopath is for me to train them to understand how to give a case to a homeopath also. So now, sometimes the patients are so, see, they understand what exactly I need. They need, this is again an online case. So in the times of online case, I want the mother to examine, right? So examine if the head is hot, the hands are cold or feet are cold, if one cheek is hot, one cheek is cold. So all these things are where is there in our materia medica, right? So we want to utilize it. So in terms of utilizing that, I start educating my parents to see what is most characteristic in the child, what they have, right? Now, during the conversion, so beautifully, the mother said that, when the conversion is going on, the hands are extremely cold, right? And the child was looking weak, and there is a lot of sleeplessness as well. Now, overall understanding, the stools were hard, the urination was fine, no sweating as such. The only characteristic symptom was cold hands during the episode. Now, the case, of course, has a back history of treating for cerebral palsy in terms of, understanding of better overall well-being. But in terms of acutes like this was one of the acute that was very characteristic, and they did not want to start off with Gardanil or any other anti-epileptic. So they reached out to me with this very simple presentation, but I actually failed in this case. Like I did not do. I was a bit, how do I say? I was a bit biased because I had taken the case बहुत सारा, I mean, like a lot of case taken, but to come to a remedy, it had taken me for a while. But in this acute situation, the first prescription was wrong. Definitely, I did fail in this thing, but that did not stop me from sending them to the allopath. But I wanted to continue my search as well. So, what are the remedies that you can think of? Now, Artemisia, no, it did not. Cuprum, very good. Yes, Dr. Dhanashri. Artemisia is a wonderful remedy in itself when there's a complete, you know, change in the opisthotonus and everything. This was a mild convulsion. Ignatia, very good remedy, Dr. Ram. Then what else? Any other remedy that comes to your mind? Now, because of my biases about the child and about, I know there's GDD, I know there is, excitement, but the only new observation was that dentition had initiated and cold hands was there. So, what I did was, I repertorized, of course, like, so I got the rubrics like convulsions, after excitement and sudden stramonium, belladonna. I'm glad that you guys are awake and sending me the remedies. That's good. We have opium, belladonna, stramonium, cuprum, coffea. So all these remedies, yes, I wanted to be very sure. Now I had been giving this child nux vomica. Now what happened was I was actually being biased to prescribe this nux vomica to the child as well. Um, Looking at this first rubric, there are only 8 remedies, and the characteristic ones were cuprum, chamomilla, hyoscyamus, ignatia, like someone told in the group, nux vomica, and opium, like same remedies. So the excitement, sudden, laughter when the child is playing, getting convulsions. Even I thought that I would give nux vomica, but I actually prescribed cuprum here because the dentition aggravation, then there is hands are cold and chillness in the um, convulsions during the convulsion. So I gave cuprum met repeatedly. I think I gave for like once or twice a day for 2 days, then again give it a gap, and then again I gave after 15 days. But this excitement, every time the child was getting excited, he would land up in conversions, which I had to stop. Otherwise, it's not gonna do good. Now, with cuprum, I did not really get much results. The child was still having this particular symptom. The child was still not able to rest well, and eruptions separate eruptions suppress cuprum metallicum, chamomilla. So chamomilla also very good, but the chamomilla child would sleep okayish, but there's a lot of violence and everything, which wasn't there in this particular child, or that mental calmness contradicts chamomilla, right? So that was contradicting for this child. So cuprum was my best remedy that I could give, which thoroughly failed. So looked up. I tried to see where I could, get a most adequate, like most appropriate rubric. But I found this rubric in the nurse repertory. I know Dr. Srinivasan has been doing a lot of NER some webinars here, and it's there in the recordings as well. Please look out for this wonderful repertory. And this repertory gives in the form of the patient's language also. So because it's a Puritan repertory. And here the exact rubric of, excitement causes convulsions of teething children with cold limbs, grinding teeth. Now, one of the things I had forgotten in the case was the sleeplessness. And when I saw this remedy, again, there's lack of sleep. I mean, I think I have a trend of having the similar cases, but the lack of sleep in this child actually, opened up my mind that, oh yeah, coffea is a wonderful remedy to make them fall asleep, right? Even during dentition conversion, ignatia is also there in the complete repertory. But I just did see NERS repertory, and I saw that sleeplessness also covers for this child, and that exactness of this rubric in NERS repertory was something I really stuck to. And within, I have just given him coffea 1M single. Yes, Dr. Sachin, you were right. You said coffea. You're the only one who said coffea. And congratulations, you did better than me, because I did not know coffea unless and until I saw this particular rubric and saw it work on my patient as well. Because with just single dose for 3 days, the child never had this kind of an attack again. So I did not need to repeat also much. So coffea was prescribed, and this was again it was an online case. So it was very, very helpful to use this particular rubric. So Dr. Binod Kumar is saying that convulsions in children dentition during, yes, chamomilla, cuprum, ignatia, nux vomica, opium, all of these remedies, hyoscyamus, they're all so good for convulsions in children who are, uh, uh, having dentition as well. So yes, good. Too much, too diff. Are you awake? How many of us are here? Okay. I think sab so gaye. Everybody sleeping? Awake. Super. So let's do.
All on mute, that's why nobody could answer.
Oh, everybody's mute. No, no, no. I'm seeing the chat actually. I'm not. I'm not seeing the. I'm not waiting for everybody to talk. I'm just seeing the chat so that people are interacting and seeing if they could add in whatever they want to. Ignatia due to fear of mother. Yes, even opium works when there is fear of fright in the mother. So super. Should we go in for another case? Do we have time, sir?
Yes, we have time.
Okay, done. So I just wanted to share a few cases which you should not miss, sort of share a few observations, like how we mentioned the last session about observations, how it can be so important for a pediatric case. So hear me out, see what you can get the best of. Now, before we move forward, I wanted to show also the Boning Essence repertory has also the similar rubric, that is generalities, infants, dentition with sleeplessness. So this was one of the things which I had missed in the first prescription when I gave cuprim. I have not considered it. And like you said, chamomilla, somebody rightly mentioned in the chats as well that chamomilla also can be a very good remedy. Now, since that NER had that very accurate rubric, plus Boning Essence, this particular rubric really, stood out for me, and coffee had really helped. So this, don't miss out certain certain repertories that can be available to us. They're definitely useful for better prescriptions. So if you see coffea cruda, convulsions of teething children with grinding of teeth and coldness of the limb. This is given in, I think, Patak Concise Metra Medica. So coffea really stood out and did a wonderful job for this child, and I really didn't have to repeat anything more. Now, moving on, let me do some case which I have shared earlier as well. For a very destructive child, if you see the child in the clinic, also whatever it is, whatever he gets, destroys it, and takes a lot of fun out of it. Takes a lot of fun. I'm so sorry. So whenever there is all these antics play, this child gets okay. Coffee I have given 1 m potency once a day for 3 days in the morning, and then there was no repetition given at all. So simple observation I wanted to ask all of you all, just to interaction, that what kind of Dr. Shivani says tarantular lachesis. So think of a destructive child who also makes, who enjoys breaking things, who loves breaking things, who laughs, "Arey dekho, look, I have broken this," and it's showing all the broken toys and screens and whatever. The happiness of, destroying something in a child. What are the remedies that you think of? Tuberculinum, tarantula, lachesis, belladonna. Wonderful. The single remedy rubric is actually, APIS. APIS is one of the remedies. I have given this when the child laughs about it. So whenever the child is breaking things, they desire to break a lot of things around, but the child is laughing about it, I always think of Apis mellifica, and it is really helpful in my practice. So I always try to mention about this observation so that you can also use it. Yes, Dr. Alpesh Ozag, you're right, Apis. So I want to share one case that um, recently came to my clinic, because I know we have 15 minutes and I'm gonna go right on there so that, can you see my screen? I'm so sorry.
Oh.
This was one of the cases where, I took the photo after half the work has been done. So I wanted to share this case. Now, this is a case where the child has a lot of eruptions on face, hands, legs, and started from 6 months of age. The child is 9 months, actually, almost going to be 1 year. So since the formula fed, weaning or formula both was given, probably that time the child was has started this particular symptomology. There was constipation. This was last minute addition, so I've just copy pasted from my case history just like that only. So you will see this is, I'll just write it down the same way. Constipation, which was hard. The stools were hard, but the child is not really crying. Sometimes the child finds it difficult to pass even normal stools, but the child doesn't cry when the stools have been passed. Uh, Papules everywhere. Basically, the skin eruption I'm talking about. The intensity of itching increased, so they went to allopathy, and appetite, hunger, everything okay. So I have not formed any sentences. I've just copy pasted so for you to see. Choosy eats only ragi or potato, doesn't like sweets, likes only with salt. Now the the case totally changed for me when the mother said the child is passing once in 3 days and it is hard and doesn't cry. Now, a less than 1 year old child is not passing stools every day and it's not formed. It is very, very hard as well. And that was my matter of concern. And I started probing more about that, about the stools. The skin was definitely quite, if you see the photo, if you can see this part, it was actually worse than this, but I've taken it in the second follow up. Now, what did I do was I know that you saw the remedy, but what are the remedies that come to your mind, please? Um, Very simple case, very, very simple case. What are the remedies that you can think of? A choosy remedy which with a lot of eruptions on hands and face started when the weaning was initiated. She was also on some amount of formula feeding. What are the remedies that comes across? Constipation, not pass stools for 3 days. Alumina, sulfur, alumina, lico. I love the interaction. Calcarea, very good because calcarea also has a lot of sweating. I told this child also has a lot of sweating in the head and while sleeping and while feeding as well. So unanimously, alumina, calcarea, causticum, stanicula. So my first instinct was also to give alumina, and I repertorized the case. And I got to know that, the stools being dark and black, stools being very, very constipated, especially in nursing children, was one of the key remedy. Even though I had a notion that, soft stools, pasty stools, but, child is finding it difficulty. And but then I prescribed alumina for this child, because of the epoch, the ailments from where did it start? From weaning, from adding formula food for the child. The ailments from became very, very important here for me to address. Though the complaint was ailments from complaint was for the skin, I took the ailments from bottle feeding or artificial food, and then I prescribed alumina for it. You won't believe it, the child's skin just cleared up.
Yes,
The child.
okay,
there's a video.
That's the reason I don't know. Sister, yeah, it is going like mango puree. Like mango puree only. So this hand is. Show me your hand. Show me your hand.
So if you can see the video?
Anywhere else?
Were you able to see the video? So the
Yes.
child's skin just cleared up with just alumina, and I did not really have to, see the child again. More than that, I was so happy that the child was passing stools every day, and the child developed a good, ability to do the first birthday without much of difficulty, pass the stools, the skin was better. The parents wanted the skin to clear up before the first birthday, that's all. But my concern was for the child to pass stools every day before the birthday. So alumina I gave in 200 potency, single dose again for 3 days only in the morning. I gave only three pills for the child to chew on, and I did not repeat it. I repeated only once more after probably a month, for a single dose again, and that just cleared up the skin, which I did not really have to touch again. Yes, that's the gist of this particular case, which I really love because the ailments from also stood out, and I was able to utilize whatever I had read in Materia Medica, so I was excited about that as well. So,
So actually, that's coming.
so just the marks were remaining, and
like mango puree. Like mango puree.
Tools, now she's saying the mango puree. She's saying that the child was eating a lot of mangoes, and the child was also going
Anywhere else?
good pasty stools, not hard stools as such at all. So yes. That was this case, and you could reach out to me on Instagram, Facebook, wherever you find me. Most active on Instagram and on my email. That is, this is what is there on the screen about in front of you. If you have any questions, we can take it up. And I think this time I finished on time and did not pass that 45 minutes, 1 hour session. So thank you, Dr. Dhanish, again for conducting this on such a regular basis. I'm loving all the YouTube recordings because I know that students have been beneficial about with all that you're doing for the homeopathic fraternity. And I know there's a huge chunk of webinar that is available on your YouTube channel, which I'm also slowly gonna start listening to one by one whenever I get time. So thank you so much, Dr. Dhanish, and the whole team of IFPH as well.
Thank you, Dr. SHEETAL BIDRI. It's really a wonderful session indeed. A practitioner of 10 years of experience has delivered something like a man of experience of more than 40 or 50 years. That's the beauty of your presentation. You try to find out even the single minute problem of each and every case. That is the beauty. Entering into the patient and finding out what is what and what is to be looked into. And this is what every homeopath has to do. And because most of the doctors coming out of the colleges are doing in a different way. They always observe such symptoms that are common to the patient, and they end up with a wrong remedy. But frankly, you will have to look into what is rare in a patient, what are the things not seen or not observed. Really, you are losing, you are on the losing part of the side if you are not looking at clearly. So Dr. Sheetal, even with the 10 years of experience, is looking at every minute angle of the case, and she is getting wonderful success in those cases also. So each and every one can be a successful practitioner if you follow these rules put forward by Dr. Sheetal here. And definitely, that will be a big boost to the juniors as well as the seniors, because since because of hurriness, because of family problems, and because of engagements, we are not able to get time to read things. But even without reading, you can observe and you can find short ways. That is what Dr. has shown, how to use the repertory in those conditions. For example, in this case of vomiting, nobody thought that malaria will be the remedy coming over there and going to save the child. Everybody expects on the other side it may be a case of aethus, sometimes it may be a pica like that. But there are rare remedies which are there in the kitty, which is to be utilized. Then you may get a easy uh, relief to the patient, not only to easy relief to the patient, but also it bring a permanent cure to the patient also. Anyway, congratulations for such a wonderful session. Hope we can do some more presentation in whatever be the, whether it be geriatric, pediatric, or whatever female complaints, whatever itself. As you rightly point out, we are uploading our videos, and only even doing so much things. We have just reached the milestone of 5,000 subscribers, but only.
Congratulations.
But frankly, we are supposed to reach more than that by the time, since we are promoting these things among public, but unfortunately, the reach is not as expected as what we thought. Anyway, nowadays, since the inception of our Hindi session, more people from North India started watching, and otherwise it was just a South Indian program like that. Anyway, congratulations once again. Hope
Congratulations to you too. 5,000 is not a small number, and don't be disheartened, because to reach to this point it takes a lot of time. Every day you're showing up and listening to all the speakers. So congratulations, sir, and all the complete team as well.
Thank you, Dr. Sheetal. Please come up forward, my dear friends, to ask your question as well as your suggestions, and whatever may be. You can ask any doubt also. You can ask whatever thing. Please raise your hand, so then only we will be able to have a proper communication with our guest of the day, Dr. Sheetal. Now, somebody, only one person, that is Ganga, that may be accident. Dr. Ganga Sagar Singh, sir, you want to speak? If you want to speak, please unmute yourself, sir. I think it was by wrong.
Maybe it was on from a very long time, the hand.
Yes, that was there sometime before itself. I am inviting Dr. Rambaris also to say a few things.
Thank you, Dr. Dhanesh ji, and congratulations, Dr. Sheetal Bidri madam.
Thank you,
Very
sir.
good, very good presentation, clinical case presentation, and pediatric case presentation. Very good, beauty of homeopathy. Repetization, cophia, agnesia. Agnesia is a very good remedy. Convulsion during feeding, yeah, during dentition period.
It also is
So
there
very,
in
very,
convulsions due to excitement as well. Even in
many
OB
kinds of medicine, cuprometalcum, carmemula, etc. लेकिन pediatric remedy जो है, agnesia and cuprometalcum is a very good remedy.
Yes.
So very, very thanks, Dr. Sheetal madam. Thank you.
Thank you, sir. Thank you, Dr. Ram.
And now I invite Dr. Maria Salceda from Bolivia to say a few things.
Thanks, Dr. Dinesh. Hello, everybody. Hello, Dr. Shita. Thank you very much for your explanation. It was amazing. It's very difficult it's a challenge for all of us to have a pediatrician patients because they can express a lot of things. So you have to sometimes just to think about what he or she is feeling and have the correct symptom. And then all the process for the homeopathic treatment. So thank you very much because you have an impeccable explanation about the cases. And I am living in La Paz, Bolivia, South America, as Dr. Ganesh told you. And in my experience and in my practice, we don't see very, very often the alumina cases. So you are giving me a homework to review that remedy.
I love that.
Yeah, thank you very much.
Please, I love it if you're taking up a challenge and reading up. If you read up, please email me and tell me what are your thoughts about the case and your understanding as well.
Okay, thank you very much. Sure, I will be mailing you and giving you my abstract, and of course, I'm sure I will have a lot of questions about alumina and the pediatrician cases.
Sure.
So thank you very much, and thanks to all IFPH team because always you give us excellent, brilliant conferences as speakers as Dr. Sheetal. Thank you very much, Doctor.
Thank you so much, Maria.
Thank you, Dr. Maria Salceda. With that, we come to the end of the day. Before that, let me say a vote of thanks. Dr. Maria Salceda to say a vote of thanks also.
Thank you, Dr. Dinesh. So we are concluding one day more in this important challenge and this important mission of IFPH of working in spreading homeopathy. We give the vote of thanks to Dr. Sheetal for the brilliant explanation that gave to us. Thanks for show us all the challenge that we can arrive with homeopathy with a success. And thanks, Dr. Dinesh, for always support us in being a better practitioners day by day. So thank you very much. God bless you all. Thank you.
Thank you, Dr. Maria Salceda and Dr. Sheetal Bidri for such a wonderful evening. And thanks for those who participated in the session also.
Wishing everybody a happy Ganesh Chaturthi as well. So we have our festival. So thank you so much.
Thank you once again. And tomorrow we will have a session. She will be talking about the scope of homeopathy in cerebral palsy and learning disabilities. It's over to Dr. P. Shaila to begin the Malayalam session. Thank you all. Good night.